Causes of hearing loss. Hearing loss can occur at any time in life. It is almost always caused by age or exposure to loud noises, but it can also result from infection or injury. Whatever the cause of your hearing loss, you could probably benefit from wearing hearing aids. The following are the causes of hearing loss. Age-related hearing loss. Age is the major cause of hearing loss. As we get older, the effectiveness of our hearing systems is gradually reduced. When hearing begins to weaken, it becomes more difficult to hear soft voices and high-frequency sounds, such as the voices of children and women. People suffering from age-related hearing loss may also find it very difficult to follow conversations in the presence of background noise. Because it is a gradual loss, you may not realize that you have lost some of your hearing. It is often family members who notice an age-related hearing loss, even before the sufferer is aware of it. Noise-induced hearing loss. Repeated exposure to high noise levels is a common cause of hearing loss. If we are exposed to loud noises, the sensitive hair cells in the inner ear become damaged and die. As the number of hair cells decreases, the ability to hear is lost. Some people are at greater risk of developing hearing loss caused by noise at work, such as military personnel, musicians, daycare teachers, industrial and construction workers. Listening to loud music at live concerts and through headphones can also damage your hearing. Therefore, we recommend that you wear hearing protectors whenever you are exposed to excessive noise and turn down the volume when using headphones. 4 types of common hearing problems. More than 26.7 million Americans over the age of 50 have hearing problems. In many people, hearing loss occurs so gradually that they barely notice it. In others, their ears seem to work well one day and not so well the next. Look at these 4 common types of hearing problems and what you can do about them. Difficulty listening to people in a noisy restaurant. Why it happens. As you age, especially if you've been exposed to loud noises often, you may develop presbycusis, a type of gradual hearing loss caused by the death of hair cells in the cochlea in your inner ear. These are the cells in charge of translating sound vibrations into brain signals. Difficulty hearing in noisy places often represents one of the first perceptible signs of hearing loss. This is because filtering background noise is a fairly complex process that requires accurate auditory information from both ears. Quieter conversations are not so overwhelming. How to solve it? While it is not possible to repair damaged cells, you can prevent further loss by limiting your exposure to loud noises. Most conversations take place between 40 and 60 decibels. Any sound above 85 decibels puts you at risk. Common culprits include electronic devices such as iPods, music players and loudspeakers that can resonate to 105 decibels. If hearing loss begins to affect daily activities, talk to your doctor about hearing aids. And before you do that, keep this in mind: newer models are so subtle that they are almost invisible. Warning: people with kidney or heart failure are at increased risk of developing presbycusis. Researchers believe this may be because poor kidney function leads to an accumulation of toxins that can damage nerves in the inner ear. And cardiovascular disease can reduce blood flow to the inner ear. Improving kidney or heart function will not reverse hearing loss, but it can prevent it from becoming more severe. A formal hearing test is recommended if you have any of these disorders. If you have hearing loss, check your kidney and cardiovascular status. Sensation of clogged ears. Why it happens. Excessive mucus from an infection or allergy can block the eustachian tube, the small canal that connects the throat to the middle ear and regulates the flow of air, particularly when you swallow or yawn. In addition to feeling clogged ears and muffled hearing, you may experience ringing, pain or tinnitus, ringing in the ears, or difficulty maintaining balance. An accumulation of wax in the ear can also cause this feeling of having the ear blocked out. How to solve it? Most eustachian tube dysfunctions improve when the infection subsides. If not, a doctor may prescribe decongestants and antihistamines to help reduce inflammation. As for earwax, any health professional can remove it with a suction device, irrigation or a nasal spray. But don't try to do it yourself, as you could easily damage the eardrum. Warning: if your hearing loss with a stuffy feeling is accompanied by severe pain, it may be swimmer's ear, an infection of the ear canal that carries sound to the eardrums. The infection is usually caused by the presence of water in the ear, which breaks down the skin and provides a breeding ground for bacteria. Swimmer's ear is usually treated with antibiotic-containing ear drops. Sudden hearing loss. Why it happens. Inflammation or fluid buildup from a virus or ear infection can affect hair cells and nerves, as can high doses of certain drugs, such as aspirin, intravenous antibiotics, chemotherapy drugs, and diuretics. Fluctuating hearing loss accompanied by dizziness, nausea, or balance problems. Why it happens: you may have developed Meniere's syndrome, a rare disorder with no known cause that alters the amount, flow, and chemical composition of endolymph, the fluid found in the inner ear. According to the Hearing Health Foundation, about 500 people in the United States have this disorder. How to fix it? This syndrome cannot be cured, but it can be treated. A low-sodium diet and a prescribed diuretic can help reduce fluid in the inner ear. In rare cases, doctors may recommend injecting steroids into the middle ear to reduce inflammation or inserting an ear tube to drain excess fluid. Warning: vertigo accompanied by fluctuating hearing loss may be a sign of other medical conditions, such as a change in blood pressure, cardiovascular problems, dehydration, and anxiety. If you suffer from this type of hearing loss, immediately consult a primary care physician or otolaryngologist.